would firstly like to acknowledge the traditional owners on the land in which we're meeting today, and I pay my respect to elders past, present, and emerging, and to any Aboriginal or Torres Strait Islander people who are with us today. I'd like to extend a warm welcome to Dr. Mark Buzza and Dr. Bethany Anderson. Mark is the Head of Research, Innovation and Advocacy at the Pancare Foundation, where he takes a highly collaborative cross-sector approach to improving outcomes for patients with an upper GI cancer via a collective impact model. Mark has overseen global program portfolios across biotech, pharma, health services, and the not-for-profit sectors, and has previously served as the Head of Research at the VCCC and the Global Director of Research at Movember. Alongside Dr. Buzzard today, we have Dr. Bethany Anderson. Bethany is a Programs Coordinator working across research, innovation and advocacy portfolios. With a background in cancer and rare disease medical research, Beth brings analytical thinking, strong coordination skills and communication skills to drive meaningful impact. Today, they will present to us an inside look at the important work underway to improve outcomes for people that are affected by upper GI cancers, including liver, esophageal, pancreatic, stomach, and biliary cancers. Thank you.
Thanks very much, Alison. Really appreciate the opportunity to be here. And yes, nice to virtually meet all of you. Thank you for joining and for your time today. And thank you for setting this up, Alison and Joe. So we're going to give you a bit of an overview of the work that we do here at Pancare, Beth and I, across the research, innovation and advocacy portfolios. And we'll probably talk for about half an hour or so, and then we can open it up for any questions that you might have. But if you've got any burning ones, you can put them in the chat or put your hand up, or we can keep it fairly informal. So Beth, next slide, please. So this is just an overview, not expecting you to read all of this and just going to go through it at a high level, but this is essentially what we call our next frontier strategy to try and transform outcomes for the people that we serve who are impacted by upper GI cancers. This is what we call our strategy on a page, and the sort of the work that we're undertaking over the next 3 years as part of our strategy. The 3 pillars you can see vertically running down that really are our major programmatic areas of investment and effort are around our supportive care or PAN support programs. This is where Alison and Joe and Prue and the team do a wonderful job supporting patients and carers who are impacted by an upper GI cancer and using an evidence-based model of care after their diagnosis, and really allow them to sort of have the best possible interactions they can with their care teams. Then Beth and I oversee the advocacy side of things, which we'll talk a little bit more about in a few minutes, and also the research side. They're the 3 pillars. You can see running horizontally, there's a whole lot of what we call enabler strategies. So things like collective impact, fundraising, marketing, innovation, operations, and governance. They're the things that sort of really support us to deliver on our strategy. And I'll talk to some of those aspects, particularly around collective impact and innovation a little bit later as well. And the whole thing is really sort of underpinned by a very large piece of work, a large national landscape analysis that Pancare conducted back in 2022 called the State of the Nation Report. That sort of was a huge piece of work consulting with consumers, policymakers, industry, key opinion leaders across the sector to really understand where the barriers and challenges are and the opportunities to try and drive change. We're doing a refresh of that project at the moment, and Beth and I'll talk to you a little bit more about that particular initiative and how it's going to drive prioritisation of some of the effort we do over the next 3 years. So Beth, next slide, please. The problem that we're trying to sort of solve with upper GI cancers, and this is going to not be particularly surprising to people on this call, but sometimes it is very, very challenging to diagnose upper GI cancers due to the vagueness of the symptoms and the late presentation. And then this leads to sort of late diagnoses, and when there's late diagnoses, there's often a poor chance of surgical intervention. And when there's a poor chance of surgical intervention, that does lead to poor outcomes and poor quality of life and poor survival rates. So we've got our work cut out for us to really try and change that paradigm. We feel that sometimes these challenges are exacerbated within the sector by a lack of collaboration and coordination by key groups across the sector, and that's where we think we can step in. So our proposed approach is to sort of leverage Pancare's reputation and our existing leadership credibility, particularly off the back of that State of the Nation report that I mentioned earlier, and reposition Pancare as a national leader in the upper GI cancer. So UGIC is just an acronym for upper GI cancer sector, using a collective impact model. And we'll talk a little bit about what that is in just one more slide. But the idea is really to bring stakeholders together using a partnership approach. And we think that's going to drive, from an outcomes point of view, stronger collaboration and improve patient outcomes. So I'll talk to you about that right now. So Beth, if you wouldn't mind going to the next slide, please. So this is the model that we talk about when we think about collective impact. Basically, five key principles as part of the model. A common agenda, so setting a common agenda between different stakeholders, having shared measurement, mutually reinforcing activities, continuous communication, and really importantly, a concept of this backbone organization that actually, if you look at the sort of the schematic diagram down the bottom, that acts as this kind of coordinating glue between different stakeholders in the sector and different people working across the sector on a similar group of topics to try and change an outcome. Oftentimes people sort of are doing this fairly much in silos or in isolation, and you get kind of, at best, individual impact. But then if you sort of use this model, you're more likely to get coordinated impact. And then when you really start to have mutually reinforcing activities and you start to think about how you can actually integrate some of the efforts between different groups, you start to get this concept of collective impact, which is not a model that's come up in the last couple of years. It's actually was first published in 2011 in Stanford Social Innovation Review. It's very common across education, community development, certainly in health, environmental protection, etc. So this is a well-worn model that we would like to implement more and more as we move forward. Next slide, please, Beth. So this is a piece of work. So leveraging off some of the work that I did, Alison mentioned I was the global director of research, prostate cancer research at the Movember Foundation. So we did a lot of this global collective impact in the prostate cancer setting, where we brought different groups like different clinicians and researchers and industry and policymakers all together to sort of try and drive change. And so we ended up publishing the work that we did back in Stanford Social Innovation Review in 2016. So yeah, I think there's a lot of lessons learned that across the work that we did at Movember, certainly the work that I did at the VCCC Alliance, across all cancers now at Pancare. But really the key lessons learned is that collaboration really just doesn't happen organically. You really have to foster collaboration and try to actively reduce duplication in order to get accelerated outcomes. And you really do need to resource the coordination component. You can't just click your fingers and expect it to happen. Next slide, please, Beth. As I said before, we're really aiming to maximize patient outcomes by leveraging the State of the Nation report and then doing a refresh of that, and Beth will talk to that later. We want to align with key national cancer frameworks like the Australian Cancer Plan, National Pancreatic Cancer Roadmap, etc. We don't want to be duplicating. We want to be kind of, being coordinated with larger national efforts. And we think that showing strong leadership in collective impact and being that backbone organisation to bring key players together is going to foster collaboration, reduce duplication, especially when there's limited funds across the sector. We want to try and make sure that there's bang for buck for the use of those funds. And we think that it'll enable a shared purpose and garner greater alignment and sort of allow us to have those mutually reinforcing activities that I talked about. Next slide, please, Beth. So we're already kind of underway really in terms of creating this new mantra, which is that research is not always about funding individual scientific projects. These can be absolutely impactful, and we've certainly invested in some individual pieces of research over the years, before Beth and my time, that has been, incredibly impactful and continues to be impactful. And Beth will talk to those in a second. But I think there's also the opportunity to supplement that with a collaborative and collective impact approach across the sector to try and drive meaningful, lasting change. And then you're more likely to get a much more efficient use of national resources, accelerated change across the sector, and actually think that, the demonstrating that that change can actually have a positive feedback mechanism where it actually leads to new funding, either from government or other partners and improve patient outcomes sooner. So we're already collaborating with a range of folks across the sector to try and implement this collective impact model. Next slide, please, Beth. So I'm not going to go into any sort of major detail here other than to say that each part of our strategy has four focus areas or priority areas that we want to focus on. In terms of research, it's really around prevention, early detection and screening. So things like better biomarkers, AI and technology enabled diagnostic tools, working with industry to sort of get better tests developed and integrated into the clinical community to sort of support clinical decision making, get earlier diagnoses where we know there's better outcomes. We want to look at active surveillance of high risk groups, for example, those who've got a very strong family history. And there's obviously strong links between research and advocacy across all of these different domains. We want to have a focus on precision medicine, where we understand the gaps in biology that sort of are barriers to the development of new drugs. We want to sort of focus on genetic testing because we know that once we, enhance genetic testing, people are able to find, genetic mutations that they've got that are driving their cancer, and that allows them to hopefully sometimes either get onto trials or onto programs that get them targeted therapies that address those specific mutations. And we know that they are starting to have some really great outcomes across other cancers and certainly now in upper GI cancers as well, but it is still a long way to go. We're going to have a focus on supportive and palliative care, so psychosocial models, digital tools, culturally appropriate care. And we also want to have a big focus on data and registries where we look at national data platforms, link into patient registries and sort of support research that produces evidence that actually informs health policy and systems change. Next slide, please, Beth. So I'm not going to go into these at an individual level, but just that we've certainly got a growing list of stakeholders that we're sort of collaborating with very, very strongly across industry, other not-for-profit groups, government, medical research institutions, etc. So just a range of stakeholders, and that list is pretty much growing by the day. Next slide, please, Beth. So some of the research collaborations, just to give you a snapshot, and then I'll talk about some advocacy. Beth will talk about some of the research projects we've invested in, and then onto advocacy. But we've got an ongoing collaboration with a pathology or genetic testing partner, really sort of exploring out how to sort of increase access to genetic testing and also supporting education initiatives around genomics and pathology. And we know that that genetic testing is that pathway to what we call precision medicine and targeted therapies, which is really the next frontier in therapies for cancer. We're partnering with some diagnostics partners around early detection tests for upper GI cancers. And again, there's a strong link into advocacy here, but we've been supporting them with clinical trial design and submissions into what we call MSAC, which is basically looking at ways to get tests to be reimbursed via the medical benefits, Medicare benefits scheme, rather than having those out-of-pocket test costs that sort of obviously cause things like financial toxicity, which is a huge burden that people who are impacted by upper GI cancers are going through. We're supporting, working with an Australian biotechnology company to support them on the development of their what's called Medical Research Future Fund grant submission. So basically bringing lived experience via a focus group to ensure that their proposed sort of grant aligns with sector priorities and ultimately patient needs. And so we're sort of working with them to sort of design a clinical trial that patients will kind of most benefit from and that's going to be acceptable to them. So again, that's kind of in that precision medicine domain. And then we're trying to constantly foster consumer engagement into research to try and make sure that that lived experience voice gets integrated at the very, very early stage, so that researchers can actually kind of think with the end in mind or start with the end in mind. So they really are designing their research programs and their grants and their funding mechanisms in a way that's actually going to address the most important issues as per the voice of the consumer, rather than making assumptions around what they think consumers need. Next slide, please, Beth. Beth's going to talk to our existing research before Beth and I got here, but Beth, over to you to talk about these.
Thanks, Mark. Yeah, as Mark said, these are some of the existing research investments that Pancare's made since 2011. You can see this is slide one. We've got another slide. There's been a lot of projects funding doing some really important research that's led to some really great breakthroughs in things like familial cancer testing and programs that are still running today. May notice that there's quite a lot of projects that are on pancreatic cancer, and that's something that we're aware of, and we're trying to diversify across the other upper GI cancers. And I'll just highlight most recently, we've funded one on gastric cancer at the Olivia Newton-John Cancer Research Institute, and that was in alignment with our recent Women of Impact event. So there's still a few ongoing, and the State of the Nation that I'll talk to later, that will drive what we're investing in next, which areas are most important to keep investing in. Back to Mark on advocacy.
Thanks, Beth. We're doing a little bit of a tag team dynamic duo today, so you'll be here for Beth in just a sec as well. But so this is the advocacy pillar, again, very much driven by this collective impact model that I talked about. So we do want to collaborate very, very strongly with others in the sector who are doing good work. So if you look at that Venn diagram in the middle, we collaborate with many others and support them with their work, and we act as a voice to amplify their mission where it makes sense to. But then we will also drive advocacy initiatives, just as we'll drive research investments once we've got the results from the State of the Nation report that we're expecting in June. So we will start to sort of hone down on our advocacy priorities even further in this back half of this year. Thanks, Beth. Next slide. So just to sort of define advocacy, sometimes there's a bit of confusion in terms of in the US, sometimes the word gets very intermingled with the word lobbying. We think it's more than that. We think advocacy is more than just kind of, asking government for money or for handouts. It's actually really an intentional action implemented jointly and in favour of individuals and communities, especially for those who suffer from health inequities, with the aim of preserving and improving health, well-being and empowerment for health promotion. So that's the definition from the National Health Institute 2022, and we think it's a pretty good one. But it is basically about trying to really just support communities within society that often fall through cracks. Got to advocate for everyone, but it has also very much got an equity lens, which we are trying our best to look at as part of our advocacy work. Next slide, please, Beth. So I'm not going to go into all of this detail here, but these are our advocacy focus areas, just like we had 4 in research. We have 4 in advocacy as well. These are really around greater access to effective treatments and genomic testing, increase large-scale research funding into upper GI cancers. So sort of raising the profile of upper GI cancers with ministers and members of parliament and government, and trying to sort of garner ongoing support, present data around what the needs are, and then, outline how we're using a collective impact model and partnership model to try and drive funds into the area. And we also work to ensure that people impacted by upper GI cancers receive care as outlined in the optimal care pathways. And we use registries and connections into patient registries to look at variations in care, to advocate for improvements where that variation in data exists. And that's often linked to priority populations, lower socioeconomic groups, etc. We also really want to sort of make sure that people impacted by an upper GI cancer have access to evidence-based supportive care. And we're incredibly lucky at Pancare that we've got Alison and Joe and Prue and Sue and the team that are doing just an amazing job of supporting patients and carers through what is obviously a very, very difficult time through an evidence-based model. Next slide, please, Beth. Again, not going to go into detail here, but just a range of stakeholders as part of a collective impact model that we're working with across industry, not-for-profits, non-government organisations, government, medical research institutes, etc. And again, that list is growing out day by day. Next slide, please, Beth. So this is a piece of work that sort of spans, I guess, research and advocacy. It really is a sort of a multimodal attempt to try and address one of the really key barriers that I talked about before, which was this kind of need for greater earlier detection of upper GI cancers, and also looking at how we can tap into those high risk populations within the communities to try and reduce the burden of upper GI cancers. So this is a piece of work that we did as part of a pre-budget submission to where we designed a collaborative multimodal program highly aligned to the Australian Cancer Plan that Cancer Australia leads and addresses aspects of underlying issues around the poor outcomes for upper GI cancer. So we put in a request for $9 million over 4 years. And obviously there were options to fund individual or bundled modules depending on budget constraints. The application is currently unfunded, wasn't funded in the current budget, but very, very few pre-budget submissions were, although we have ongoing conversations with the Department of Health and Cancer Australia, but it has also opened up really important conversations with Cancer Australia around how we can work with them and collaborate with them to implement the Australian Cancer Plan in a way that that sort of starts to address some of these key issues around upper GI cancers. Next slide, please, Beth. Not going to go into a whole bunch of detail here, but just to sort of make the point that each of those modules has got a range of top-line deliverables that we were talking about trying to deliver collaboratively, and we'll continue to advocate for. But it's things like rapid access and sort of driving awareness in the community of some of the symptoms and risk factors of upper GI cancers, and making sure that people at high risk get to see their GP, but also then working with GPs and the primary care community to upskill and make sure that they've got the skills and tools that they need to effectively diagnose and refer on and tap into clinical referral pathways to sort of ensure that those diagnoses where they can be are diagnosed sooner rather than later, so that individual person can have the best possible outcomes. We wanted to have like a data and learning hub associated with it, or like a concept of a learning healthcare model. And then, as I said, there'd be these kind of awareness and education campaigns linked to it as well. So I'm not going to go into a whole bunch of detail, but that's essentially the overview of the modules. Next slide, please, Beth. Not going to go into detail here, and certainly not expecting anyone to be able to read this, but it basically just outlines where each of those 5 modules links into each very, very specific strategic objectives as listed in the National Australian Cancer Plan. So again, really trying to tie in with national frameworks, make sure that we're integrating rather than duplicating. Next slide, please, Beth. So this is my last slide. I'm going to hand it back to Beth in terms of advocacy, and then I'll just have a quick chat to you about some of the work we do in innovation. But this is sort of some of the ongoing stuff that we do in terms of trying to create that awareness in the clinical community. So this is a publication that the wonderful Melanie Regan and I published in Medical Journal of Australia Insight, where we're trying to sort of raise the awareness of pancreatic cancer in this case, and talk about some of the priorities, some of the needs around long-term investments in research and clinical innovation, workforce capability, and equitable access to care. And we know that hundreds and hundreds of healthcare professionals read these types of journals. So these types of things kind of all sort of help to raise awareness for the cancers that we're trying to advocate for. So Beth, I'll hand to you for a sec, and then I'll take it back from you.
Thank you, Mark. Yes, I just wanted to highlight a few more specific examples of some of the advocacy work that we're doing. So we work with a lot of big companies to bring early detection tests to Australia, or bring different medicines out, or see new technologies that they're using to help detect cancers, and try and work with them in the best ways to make that available and accessible. We advocate for new medicines through letters of support for any new medicines that we think will be good in the PBAC submissions, or also MSAC submissions. So submissions to the government to show why these medicines, or it might be other devices, might be beneficial for patients in this space. We did a media release earlier this year to help improve awareness of upper GI cancers and which symptoms they should be looking for. We do some advocacy working with some nurses in Sydney who are kind of advocating for diabetes monitors for pancreatic cancer patients who've developed type 3C diabetes, so making these more accessible and reduced cost. Advocating to the Minister for Health's office and the Department of Health for more funding for upper gastrointestinal cancers. We're currently working to release some new data and reports on current insights in upper gastrointestinal cancers in Australia. Speaking with different consumers that have advocacy opportunities in the upper gastrointestinal cancer space. And we've also written grant applications for our work to kind of cover research and advocacy space and raise more fundings to continue this work. Another scheme that we're part of is the Victorian Patient Transport Assistance Scheme, or VicTAS Alliance. So this was established in October 2025 by Cancer Council Victoria. So currently this scheme provides financial subsidies for patients to attend medical treatment. So it might include covering costs such as petrol or accommodation, or in some cases flights. And so at the moment, the Victorian subsidies are the lowest across Australia. So the Alliance is calling for the Victorian Department of Health to increase the scope of the program to include a few things that previously weren't included, such as dentistry or some clinical trials, and also to increase this subsidy to be in line with other states and also inflation, as it's been unchanged since 2015. So far, the Alliance activities have included sending a letter to the Victorian Minister for Health. Discussions with the Department of Health are ongoing, and they've been quite receptive to discussing this and trying to improve where possible. However, as in many cases, the funding situation is the greatest issue at this point. And Cancer Council also submitted a pre-budget submission that included this advocacy work. And we've had a couple of small wins, including the expansion of the program to include specialist dental and non-commercial clinical trials. And there's also been an overhaul of the online portal, so trying to make it a bit easier to apply for. However, we're continuing the advocacy to try and change the policy and increase the subsidies, as this is still a very pressing issue. And as we've kind of spoken about many times throughout this session, I will give you a bit of a summary of the State of the Nation refresh project that we're also undertaking at the moment. So we previously released a State of the Nation report in 2022, and that was based on data collected in 2021 and a little bit in 2022. That was the first comprehensive national analysis of upper GI cancers in Australia. The key outcomes were defined a vision, goals, priority investment areas, governance model, enabling infrastructure needs for upper GI cancer research mission. And they also were a really important factor in driving Pancare's advocacy from this time and also our current strategy. It also informed policy discussions, guided research and service investment up to now. So why do we need a refresh? The data collection are currently now over 5 years old, so about time to update these. And there's been a lot of progression since this time, such as new immunotherapies and targeted treatments, increased use of molecular and genomic testing. And the previous report had less of a focus on pancreatic cancer, as Cancer Australia's roadmap was being created at the same time, so they didn't want to kind of overlap there. So we also want to make sure that that's a part of this new report. There's also the opportunity to reflect on changes since 2022, recent development, new barriers or gaps that we're seeing, and we can align with Pancare's strategic priorities that we've outlined, Mark has outlined earlier. We'll also provide a new evidence base, which will be critical for our systems mapping, gap analysis and policy improvements, and it will guide our prioritisation, effort, investments, partnership across research, advocacy and innovation. So it will help us decide which research we want to fund and prioritise and where we want to go with our advocacy plays. So the progress to date, we've been working with Healthcare Management Advisors, or HMA, and they have been conducting interviews, surveys, consultations for us. So that included an interview with some of the Pancare staff to learn about the suggestions that were implemented from the previous report since 2022, which most recent example of that was a biliary OCP that was released, I think, in March. They conducted a survey of over 70 healthcare professionals, government representatives, other upper GI cancer not-for-profit agencies, industry representative and researchers covering all 5 upper GI cancers. So this included 63% clinicians, 23% sector representatives, which included government and not-for-profit, and 13% of researchers. We also conducted 16 consultations with key opinion leaders across these different agencies, and some consumer consultations were conducted by Pancare. There was also a review of the literature for updates in the field since 2022. So the insight categories that we'll be receiving soon include recent developments such as medicines, support services, and improvements in practice, and then priorities on where we should be focusing, such as early detection and screening, diagnostic molecular testing, clinical trial infrastructure, navigation, workforce shortages, awareness, etc. So that will help us drive our kind of priorities over the next few months and ongoing once we get these results. And we also heard about the impact of Pancare, so what Pancare has been able to achieve in the sector since the last report. So we're currently working through these outcomes, and yeah, as Mark mentioned, the report should be released in June. And yeah, handing back to Mark to talk about innovation and commercialisation.
Thanks, Beth. Just a couple of quick slides on this one. So next slide, please, Beth. So basically, we've put together, just thought we do an increasing amount of engagement with consumers across our networks, which is a really, really fundamental part of who we are as an organisation, understanding what we call lived experience and consumer insights. It's just a really important way for us to be able to make sure that the things we're investing in especially across, supportive care, research and advocacy really is driven by the voice of the consumer and the lived experience. So just an example is we've put together for a pancreatic cancer early detection test that's been federally funded, and there's a consortium of researchers and industry players that are involved, as is Pancare, a partner. We've put together what's called a lived experience insights group, so LEIG, and that's basically 4 patients and 4 carers across Australia, although there is a heavy focus on Victoria. And what we do is we get them together about every 3 or 4 months, about quarterly, so it's every 3 months, to basically work on thematic topics that are really important for this particular pancreatic cancer early detection test. The researchers and the clinicians and the industry partners all come together with the consumers at that quarterly meeting. We've trained them all up. We've kind of done introductions and fostered this kind of collaboration between them. And they basically talk about really pertinent topics that relate to the research and development of the diagnostic test. And all these insights are kind of garnered and comes out that actually sort of helps the research and team to sort of refine their research and development pathway in fairly real time based on the insights that they're getting from the consumers. So really, really important ways that we sort of, try to tap into our amazing consumer network in order to sort of try and optimize research and get, better and faster outcomes for the things that we're involved in. So, for example, some of the things that have come out in terms of those experiences, with the first meeting alone, we got so many incredible insights just from a 90-minute meeting around experiences of the diagnostic partner journey. So we're really trying to understand experiences of diagnosis from both a point of view of a patient and from a point of view of a carer, to sort of, really understand what matters most to them to try and drive optimal care in the future. So the discussion question was really what was happening in the weeks and months ahead of the diagnosis that were red flags that triggered further investigation in the health system, and what was the first point of contact with the healthcare system in that matter, and what were some of the subsequent points of contact. So I won't go into all of the detail, but there's so much richness that we received across some of these particular themes, like, diagnostic pathways and delays, early detection, surveillance, and genetic risks, structural and system-wide barriers to sort of getting an earlier diagnosis, some really key insights and considerations around awareness and education and public messaging, and also around healthcare workforce integration. So lots of richness there that we're able to pass back to the research team, who were then able to kind of utilize those insights to refine their research and development pathway. Beth, I think this is my last slide coming up. So this is just a piece of work that we've been doing in our innovation portfolio, which is a collaboration with the Gut Cancer Foundation in New Zealand. A wonderful group who are also supporting patients with GI cancers. What we're doing with this project is to essentially support the Gut Cancer Foundation New Zealand to actually be able to develop and implement a supportive care service like Pancare has our Pan support service with the amazing team that we've got backed by an evidence-based model of care that in a very structured way supports our team to be able to support patients and carers based on the best possible evidence there is available. So the idea is that we've been able to transfer that model of care using a piloted approach where there's a nurse now in New Zealand who's working with our wonderful team here to basically transfer and customize our model of care so that they can actually start seeing patients in New Zealand and giving them the supportive care that they need in a matter of months rather than really working it all up from scratch over a number of years as we had to. So it's really about making it, culturally safe and fit for purpose for a New Zealand healthcare setting. There's already a nurse involved. They launched the pilot of this actual service on the 1st of May. And there's already been dozens of patients that have already come through and wanting to get access to that supportive care model, with many more slotted. So really amazing that we've been able to sort of fast track that service and support our wonderful friends over the Tasman. Hopefully that was helpful. And hand back to you, Alison.
Thanks, Mark and Beth.